गुड ओरल हेल्थ से ही आती है। तो अगर आपकी हंसी अच्छी हो तो नेचुरली पहला आपका जो इम्पैक्ट होगा किसी से मिलने के बाद, वो आप काफ़ी 50% से लोगों को जीत ही लोगे अपने हंसी से। तो डॉक्टर कविता, प्लीज़ ज़ोरदार तालियों से डॉक्टर कविता का स्वागत कीजिए। दे आर इन द बिजनेस ऑफ स्प्रेडिंग स्माइल सिंस 1995। सो लॉन्ग जर्नी डॉक्टर कविता की है, और इनका ये मानना है कि दे ट्रीटेड एवरी पेशेंट डेंटल प्रॉब्लम होलिस्टिकली, राइट मैम? सो ऐसा है कि आज की तारीख में सभी को खूबसूरत दिखना है, और सिर्फ दिखना नहीं है, अगर चेहरे पर हंसी के साथ खूबसूरत दिखेंगे तो और भी ज़्यादा होता है, अच्छा है। क्योंकि आजकल इस स्ट्रेसफुल लाइफ में सबसे अगर कुछ भी हमने खोया है तो अपने चेहरे की सुंदर हंसी खो दी है। तो अगर ये हंसी लाने के लिए कोई प्रोफेशनल हमें मदद करता है तो ये डॉक्टर कविता है स्माइल डेंटल से। सो प्लीज़ वेलकम डॉक्टर कविता।
Namaskar from Dr. Kavita Kumar, and I'm a dental surgeon, and we provide comprehensive dental solutions in Parle East. So I think I'll just begin my presentation. Yeah, so a little bit about me. I'm going to go a little fast because we have very little time, and I've been told to finish it in very short time. Some of the awards that we have won as a clinic. So like he mentioned, beautiful smiles always begin with oral health, and that is the main essence of our practice. And we believe that everyone is born with a designer smile, and our duty is to help them maintain, sustain, and regain that smile if it is lost. So, and this is how we do it, by providing comprehensive dental solutions in a hygienic, pain-free, and anxiety-free manner. We transform lives one smile at a time. And we are into practice for about 28 years now, since 1995, and we've transformed many smiles and still counting. So how are we different from the others? So these are some of our differentiating factors. We have a holistic approach towards oral and general health. We believe that oral health and general health are very closely linked. It's not just, we don't just treat symptoms, we treat the actual root cause of the problem. Safety and hygiene is unparalleled in our practice, and our patients are testimony to that. We believe in creating an anxiety-free environment, because the biggest reason why people do not visit a dentist is because of the anxiety that is caused because of dental treatment. Painless dentistry, the dentistry that is practiced now is completely painless. Advanced technology, wherever new technology comes in, we try to incorporate that in our practice, and we have an expert team of specialists to cater to every need. So again, like I mentioned earlier, we don't just treat the symptoms, but we remove the root cause, which is called as functional dentistry. So it's not like, somebody comes, walks in with pain and we just treat the pain. We try to dig out the main cause. And a lot of times we find that, there must be some systemic cause or some cause related to the general health of the patient, which is affecting the oral health, and vice versa. A lot of times we are able to diagnose or identify a lot of, general health issues looking at their teeth and tongue and the oral tissues, and that is what we try to kind of bring into our practice, achieving overall health by achieving optimum oral health. There is definitely a link between oral and overall health, like I mentioned. Gum disease, like I said, is related to heart disease, diabetes, a lot of respiratory problems. So another thing that I'm really proud of is, as a dentist, we are able to identify a lot of problems like obstructive sleep apnea. You all must have heard of the unfortunate demise of Shri Bappi Lahiri. So, and the cause was obstructive sleep apnea. You will be surprised that a lot of times your dentist would be the first person to identify that. There are a lot of signs in the mouth, and we can not only identify, we can also provide solutions like oral appliances to improve airflow during sleep, and thereby controlling the OSA. So I'm very proud to say that I have treated a lot of patients for this problem. And TMJ issues, the jaw joint problems, can lead to deficiencies in your overall posture, and it can lead to not just jaw pain, a lot of other issues also. So we are very proud that we are able to treat these kind of patients, and we have gone beyond the realm of general dentistry and generally trying to just relieve pain and enhance smiles. Enhancing airway breathing, again, lot of airway obstruction can cause a lot of health problems like heart problems, and it can really, affect the quality of your life. And as dentists, we are proud that we have been able to solve a lot of these problems by providing orthodontic solutions and a lot of oral appliances. So oral health is the most neglected part of our, body. So you can see that. And the reason is the fear of pain, anxiety, and lack of awareness. And our attempt or our endeavor is to take care of these, concerns. So first is safety and hygiene. As per CDC, Center of Disease Control, Atlanta, we follow the strictest standard of sterilization and hygiene protocol. So just an overview. So we do not take walk-ins except in emergencies, and patients are seen strictly by appointments. So there is no waiting in the reception. Paperless, we are a paperless and contactless facility. There are no prescription forms. There are no forms to be filled, in paper. Everything is done online. And we have well-separated operatories, so there is no cross-contamination. We complete maximum treatment in minimum number of sittings so that patients don't have to keep coming to the clinic. So at entry, we have all these. Even in the reception, you can see there is no reading material or brochures. We have everything is on screen. Inside the operatory, we ensure reduction of aerosols by using powerful suctioning devices, and all water lines are cleaned with suitable disinfectant solutions and distilled water. So, and fresh set of scrubs. I'm just quickly running through it. So we have these HEPA filters installed. In between appointments, again, these are the few techniques with which we sterilize our clinic. 3-bucket technique, which became very popular during COVID time, but we were following it even before COVID. We give sufficient time interval between 2 patients so that there is complete disinfection, sanitization. And we alternately use both the operatories. Sterilization protocol, again very quickly, we are very proud to have been awarded the CDOS certificate by the Indian Dental Association. This is a peer-reviewed certification by the Indian Dental Association, and less than 25 clinics in the entire country could manage to get this certificate, and we are one of them, so we are very proud. We are also, recipients of the ISO 9001:2015 compliance certificate, which is very stringent again. We have a dedicated area, a separated area for sterilization, which you find very rarely in clinics in Mumbai, especially because of paucity of space. So we are very happy to have that and give that to our patients. These are some of the ways in which we maintain complete sterility. We have, packed, sealed pouches for every instrument. Just running through, we use distilled water even for the patients to rinse their mouth. Even for that, we have a water distiller, and we use distilled water for that. Hand disinfectants, and we use barrier methods. We use cling films for all the surfaces, and after every patient, the cling films are changed. Multiple sets of instruments, so no patient gets a repeated or used set of instruments. Again, going a little fast. We have, of course, well-trained set of assistants to help us with the sterilization. Appropriate waste management, which is very critical and crucial and not followed by majority of clinics. Disposables, wherever is possible. We have a separate counseling room. Again, everything is electronically communicated, like I mentioned previously, like right from online registrations to the prescriptions to everything. And, the patient form is studied well before the patient comes in, so there is no wastage of time in asking medical history and other things. Another thing I'm really proud of, and which my patients are really happy about, is that we try to give them a completely anxiety-free experience. And how do we do that? Right from the interiors to a lot of other small nuances. Like, for example, the walls in my clinic are completely white, which gives a calming and soothing effect. And there is nothing displayed on the walls, no pictures of implants and no publicity material of teeth and blood or all such things, which can actually, elevate the anxiety levels of patients. We have kept plants in strategic locations so that, again, it's a very good way to reduce the anxiety of the patient. So this is just to show how we are taking care of the anxiety of the patients, because of which a lot of patients do not seek dental treatment. And absolutely no waiting, because we schedule our appointments in such a way that there is no waiting for the patient. We respect their time, and therefore there is no anxiety again. All the educational material is provided on the TV screen. We play soothing music in the background, and the patient can choose the kind of music he would like to listen to, because music is a very big soother. It's a very big anxiety, dissipating tool. So that is what we make use of. A hot towel therapy is given after every treatment so as to relax the patient's jaw, neck, and back muscles after prolonged dental treatment. Usually the dental treatment happens for about an hour or two, so this is very much essential, and this is what our patients really appreciate. Painless dentistry, again, another thing which patients are really scared of, so we try to give them that. Completely pain-free experience with intelligent and advanced techniques of different kinds of anesthetics, and also with low-level laser therapy, LLLT. So this is a low-level laser therapy that we... So basically, I'll just take one more minute. In short, my growth stories, I started in a small place in a 250 square feet area with just one clinic, with just one chair and a rented out premises. And then slowly I bought my own place and had a 2-chair practice. Then I trained doctors to assist me. And then now I have a complete team of specialists to provide holistic growth. And branding strategy, we have a very communicative logo. Our tagline is transforming lives one smile at a time. We create awareness on oral health through various platforms, camps in schools, corporates. Personal branding is through social media platforms, and we stay up to date with the latest technology and trends. And yeah, thank you very much. Thank you to the judges, the audiences, and the team of Parle East for giving me this wonderful opportunity.
First and foremost, your certain fields seem to be overlapping with the other medical streams like TM joint or sleep apnea, etc.
Right.
As I'm aware, there are other
Yes.
specialists also do that. And secondly, at a stone throw away distance in Velapalle, there are dentists around. So how do you think with this kind of a maintenance cost, I would say, because everything has a cost.
Right, right.
How are you competitive enough in your pricing strategy?
In my pricing
Pricing or costing strategies?
So I think my pricing strategy is commensurate, obviously, with the kind of services we provide. So naturally, the patients who come to me are more quality conscious than price conscious. So it's working very well, and I'm growing. I've always grown with this kind of a strategy, and I hope to grow in the future also. So certain issues or certain aspects, like you said, TMJ and OSA and all that, they are interdisciplinary. They're not really, we cannot call it overlapping. They are interdisciplinary. So we need, a team of doctors, various specialities, right from, a respiratory surgeon or a chest specialist to a dentist to ENT specialist. So we need a team, and we work as a team. That's how we do it. But a lot of times we diagnose it first, because the patients come to us first with some other problem, and then we refer them to these kind of specialists. Thank you very much.
Just one small question. Your brand is Designer Smiles.
Yeah.
And in the entire presentation, I saw a lot of things that you do, including sleep apnea and many other things. I didn't possibly get a glimpse of what you do to actually correct the smiles or whatever. I didn't see that.
Yeah.
And there are many, fly-by-night, I can say, like operators which are pushing these transparent caps and molds to be used at home to change and correct the teeth. How are you getting any patients like that who tried that and then failed and things like that?
To be very honest, I have not personally got any patients in my clinic with such, so I would call it, deliberate accident. If somebody wants to do something like that, that is a deliberate accident is what I would call. But I do know of colleagues who have told me about such patients, and we also see on internet all over that people are just buying some fly-by-night or some do-it-yourself or do-at-home kind of kits, and they never work. They cause more, I can speak for an hour on it, but they never work, to cut a long story short. I think that was your question. Have I answered it? About 20 to 30,000 so far in my 28 years of practice, and I was already running short of time. I could have also, given some demonstration of that. And we believe that the beautiful smile, the beauty of the smile comes only if it is a healthy smile. A beautiful smile is not a smile which is white, but it is a smile which is healthy and which emanates your inner health. That's what we believe in. Thank you.